Is it possible that the world may face another deadly pandemic? There are several independent reports from China about a certain type of flu that has infected so many that hospitals are crowded like shopping malls. It has terrifying symptoms and has no cure. Some describe it as worse than COVID-19. What is it? Consider this report from China as shared by China Observer.
A blogger in China said, "This isn't China's Spring Festival travel rush. This is China's children's hospital." Another blogger shared, "The places crowded with people right now aren't shopping malls or supermarkets, but various children's hospitals across Beijing." He saw so many children getting IV drips, many of whom silently developed pneumonia. Their symptoms weren't obvious, which caught their parents off guard. Another blogger mentioned, "Hospitals nowadays are as crowded as shopping malls. Will viral infections become even more rampant in the future, or will things calm down as the population decreases?" One blogger shared a scene from December 24th, 2024, at the First People's Hospital in Yangchuan City, Shanxi, saying it was terrifying how crowded it was. A blogger who works for a Chinese radio station, Yueming, gave the public a warning.
又出现新毒株了吗？
Has a new virus strain appeared? Experts explain that it's possible for one person to be infected with multiple respiratory illnesses at once. Recently, there have been just too many patients. Let me count. My parents got sick after being infected by my kids. They're older, so their immunity isn't strong. A couple days ago, I caught a cold and was coughing. I suspect I caught some virus, like the lung virus. This virus spread in my house. My deputy director and several people on my team are also coughing, having colds and a fever.
He mentioned that everyone at the radio station now wears masks to avoid spreading germs. He wondered if the vaccines taken during the pandemic could have weakened people's immune systems. Recently, it seems new virus strains have appeared again in places like Beijing. Videos on social media show overcrowded children's hospitals in various cities, with many kids having symptoms like fever and cough. Many netizens have reported seeing widespread infections, and hospitals are filled to capacity. It's not just pediatric wards, adult wards are also packed, with many young and elderly people getting sick and feverish. People from places like Tianjin, Guangdong, Jiangsu, Shandong, Liaoning, Hebei, and Anhui have also reported that after getting infected, they had symptoms like dizziness, chills, a runny nose, sore throat, and overall weakness. It was very uncomfortable. One blogger said that hospitals in Shenyang have been completely overwhelmed, with a mix of mycoplasma pneumonia, flu, and other viruses causing a mess. It's so bad that people need to wait a whole day just to get an IV drip. The hallways are full of parents and kids, with camping gear like tents and foldable chairs being used as essential tools to survive the hospital chaos. Some people with multiple children are struggling. The situation is severe. Kids who haven't been affected yet have been advised to stay home to avoid getting infected. On December 27th, a doctor from Jiangsu posted on a social media platform that their hospital had discovered a new unidentified virus. Patients were suffering from pneumonia and respiratory failure. This virus spreads less quickly than COVID-19, but its fatality rate is much higher. The doctor shared that in his ward, out of 30 patients, 6 had already died, and 3 more were close to death. The doctor said, "Other wards haven't been affected yet, but it seems the hospital director has reported it. When will this end?" Recently, the Chinese CDC reported that the latest surveillance results show an increasing trend in acute respiratory infections across the country. Mycoplasma viruses, respiratory syncytial viruses, and other pathogens are still at high levels, and the flu season has arrived, with a clear rise in flu rates. In addition to the growing number of flu cases, recent data shows a fluctuating rise in the positivity rate of human metapneumovirus, HMPV, in children aged 14 and below. HMPV is a virus that causes acute respiratory infections, and there's currently no vaccine or specific treatment available for it. The Chinese government claims that high levels of flu and HMPV are the main concerns, without any new virus strains appearing. However, many people do not believe this. One blogger shared their experience of getting infected.
真的是没想到，原来这个病毒真的是无处不在的。
I really didn't expect it, but this virus is everywhere. Just a couple of days ago, in the evening, I suddenly started feeling unwell, and then my fever started rising, and my whole body ached. Whenever I get a fever, I always have body aches, but this time I also had pain in my buttocks. I remembered that last year when I had COVID, I had the same pain, but I didn't think too much of it. No one around me was talking about being infected, so I just had a fever for 2 days. Then slowly I started getting better. But today, when I ate, I suddenly lost my sense of taste. I never experienced that before. Even when I had COVID last time, I didn't lose my sense of taste. I thought maybe I should test, but I didn't think I would test positive. During my cold and fever, no matter what I tested, it was always negative. But this time, I was shocked that I tested positive. I think this virus is really everywhere in the air. I wonder how I got infected, because I usually don't interact with people much. Then I remembered, the day before I felt unwell, I had gone out and didn't dress warmly enough. That's probably how I got infected. Some netizens also shared their own stories. I didn't go out at all. I just stayed home and I still got infected. The virus just came down from the sky. The flu is considered the cause of many infections. Dr. Li Hongye, head of the Department of Women and Children at Hangzhou Central Hospital in Henan, told the media, "Flu is in an outbreak phase." According to our hospital's investigation, the number of patients in December has increased tenfold compared to November. One netizen posted a video saying, "This winter's flu is as strong as the COVID-19 virus from 3 years ago. The hospital beds are all full, not only in the pediatric wards, but also in the adult departments. Many young and elderly people are infected and have fevers." Another said, "The hospital is so crowded, it's about to explode." On December 25th, a blogger posted a video warning people about getting infected with H1N1 flu. He shared,
"This H1N1 flu is really tough, so everyone should be careful. My wife and I went to Guangzhou for a work event, and after we came back, she started having a fever, so I took her to the hospital. At that time, I was fine, but later, I also started getting a fever. My wife's fever reached 39 degrees, almost 40, and mine went up to 39 as well. It kept fluctuating, and I had severe body aches and headaches, just like when I had COVID. Then I found out that during the event we attended, about 8 or 9 people caught H1N1. The doctor said there's no real treatment for it. We were prescribed oseltamivir or some expensive flu pills, but other than that, it's just about managing it. It's already the 3rd day, and I'm worried about infecting my family, especially the kids. So we've been isolating in this room for 3 days now. Today the fever has lowered, but now I've started coughing out phlegm, so I think it's getting better. If you remember how tough COVID felt, you'll know what I mean. If you're going out to crowded places, please wear a mask."
Another blogger from Beijing shared their own experience of being sick on a live stream. He said the tests couldn't detect the flu.
"I've had a fever at 39 degrees for 6 consecutive days in Beijing. What's going on with this flu?"
Some netizens have shared their experiences and concerns about recent infections, suggesting that the virus might be lingering in the body after a past COVID-19 infection. One person commented, "It feels like the COVID virus is still in my body. If I'm not careful, it flares up again, and it lasts for a long time with a sore throat." Another person said, "It's not just Beijing. Flu is serious everywhere." Others noted that the situation seems worse in northern regions like Beijing, Henan, and Shandong, and according to past experiences, southern regions may see a peak toward the end of the month. One person described their experience. "On the 8th day, I kept spitting, and my heart was racing. This wave of illness is much worse than COVID." Another netizen shared, "We also got sick because of the cold weather. We didn't send our kids to school, didn't go outside, and had stocked up at home. Suddenly, the whole family had a high fever, and we don't even know how we got it." Some people even suggested that the H1N1 flu might be another form of COVID. One blogger also remarked, "If it's not COVID, why does it feel exactly the same?" Since the COVID outbreak in late 2019, the Chinese government has faced criticism for hiding the real situation, and there have been constant reports of different diseases being labeled as the cause of illness, but many people remain skeptical. A netizen from Shanghai analyzed, "This is the result of a prolonged low fever followed by a sudden high fever. This is a characteristic of COVID." One blogger said that this new virus is terrifying, especially for children who are experiencing repeated high fevers that won't subside. There's no specific medication, and the incubation period is long. By the time it's discovered, it often turns into severe pneumonia. The blogger mentioned that this was the first time they had seen long lines at a children's hospital, with a scene reminiscent of the early days of COVID. Another person mentioned novovirus as a concern. In a video, a blogger from Anhui raised the possibility of a novovirus outbreak in Hefei. He said, "My throat feels terrible. Many students are taking sick leave this week. I thought it was because of the cold weather and that they didn't want to practice. But then I found out they all have a fever and are lying in bed. Some elementary schools have entire classes on leave because of fever and diarrhea." A blogger at a hospital described the situation, noting that many children are infected with a mix of viruses, not just one type. Right now, all the pediatric beds are full, including emergency and outpatient beds. At least 1,500 to 2,000 patients are seen daily, with adenovirus being highly prevalent. Children are infected with various viruses, including norovirus, Mycoplasma pneumonia, adenovirus, EB virus, and respiratory syncytial virus. Many of these children have mixed infections, and by the time they're diagnosed, it's often pneumonia, sometimes mild, but after a few days of treatment, it can progress into severe pneumonia. It's spreading rapidly. Children with high fevers must be taken to the hospital immediately for examination. Don't delay. She mentioned that some children are even showing signs of white lung, a severe form of pneumonia. Just today, I brought a child in for checkup. This child had been sick for 3 days. After going to the hospital, the diagnosis was pneumonia. They were told it was hard to find a hospital bed, so they went to a nearby clinic for an IV. After 3 days of treatment, there was no improvement, and the child continued to have a high fever. On the 6th day of illness, the fever worsened, and upon examination, they found part of the lung was showing signs of white lung. The doctor said that this child needs lung treatment and hospitalization. On December 28th, a blogger discussed their experience with a similar virus, noting some differences from 2 years ago.
This virus feels a bit different from 2 years ago. My throat is itchy, I have a cough and fever, and my back is sore. Before, I had scalp pain, but now it's not as bad. The fever isn't as intense as last time. The difference now is that medicine is available at pharmacies, like fever reducers, cough medicines, and anti-inflammatory drugs. I suspect that over the past 2 years, this virus has become weaker. I didn't expect it to return with such intensity, though. If anyone is still buying Chinese SARS medicine for these symptoms, I honestly think no one can help them. I suspect that some people are selling these medicines to make a profit, and maybe even spreading the virus, but I'm not sure. Anyway, a lot of people around me are getting infected, and the level of transmission seems similar to what we saw 5 years ago.
Many netizens are expressing concern over the current health crisis, with some sharing alarming personal stories about illness affecting their families. One comment reads, "Even a 6-month-old baby isn't spared, with a fever of 38.5 degrees Celsius. We're just waiting for daylight to go to the hospital." On December 29th, a blogger shared their experience at the hospital, describing their child's symptoms.
Yesterday, my child had a fever, and at the hospital, we were told it was caused by a virus called human metapneumovirus. I had never heard of it before. The symptoms, fever, body aches, sore throat, and a runny nose, were very similar to what we had with COVID. I asked the doctor for a full examination with 15 tests. If you don't ask, they'll just do the usual tests for mycoplasma and flu. But doing all 15 tests up front saves time and helps treat the child faster. With all these strange viruses now, it's hard to tell if they're getting stronger or if we're just getting weaker. I'm not getting any more vaccines.
David Xu, a former director of the acupuncture department at a Chinese hospital, explained that viruses like HMPV are now mixing with other diseases, creating complex new strains. These mixtures may even lead to completely new diseases, although authorities avoid using the term COVID to describe them. Independent commentator Du Zheng believes that while the government has named several viruses as the cause of the current wave, the COVID virus has never truly disappeared. He speculates that the ongoing infections, including the development of symptoms like white lung, may be signs of a new COVID variant, but authorities have not allowed independent investigations into the situation. Du suggests that the latest wave of infections in China could be attributed to an unknown virus. Many netizens have been commenting on the severity of the current health crisis. One person described their symptoms. "I wasn't even running a fever at first, but then I suddenly started having diarrhea, followed by chills and teeth chattering. I covered up to stay warm, but by midnight I had a fever, though my temperature was normal. Then I started sweating, and the next day I continued to vomit and have diarrhea, losing 2 kilos. My eyes were sunken in. It was the worst I've ever felt." Another netizen shared, This feels worse than the previous wave of COVID. The infection spreads faster, the fever doesn't subside, and it hurts everywhere, especially in my eyes. My 14-year-old son said his tears were burning hot. Without IV fluids, we couldn't get better. One netizen commented, "It's just COVID. They're just changing the name so they don't have to cover the expenses." Another added, "If you didn't know better, you'd think it was the Spring Festival travel rush at the train station. But in reality, it's the hospital. This virus is really severe. Yesterday, my husband got a blood test. He wasn't coughing or running a fever, but the results came back positive for mycoplasma infection." A blogger sarcastically criticized the Chinese government for the current situation.
Who is responsible for making society like this? You get to the streets and there's no one. You go to the mall, it's empty. But when you go to the hospital, it's packed. This is truly leading the way, leading by a huge margin. Those who understand, understand.
Another post described the current situation as resembling the pandemic peak in December 2022.
It feels like we're back in December 2022. The streets are empty, but the hospitals are overcrowded. People are either sick at home or stuck in long lines at hospitals and clinics, and everyone's wearing masks. It really feels like we've gone back in time.
In December 2022, China abruptly ended its zero-COVID policy, leading to a massive wave of infections and deaths, with crematoriums overwhelmed and waiting times stretching up to 2 weeks. The official death toll remains unclear, as the Ministry of Civil Affairs stopped releasing funeral and cremation data, prompting widespread suspicions of a cover-up. To this day, the government has not resumed publishing such statistics.